Good afternoon. It's Tuesday, November 12th. I'm Dr. Duke Majan, CEO and founder of Duke Spine. Our patient travels from New Hampshire with chronic back pain. He's had lower back pain for 20 years. 20 years. We're going to give you a little injection, some num-num. Sorry about that. He's awake but sleepy. He will be put asleep completely shortly after we get started, but I do need my patient's help initially. All right, if you have questions during the surgery, type them up. I'll answer them for you. In the meantime, as we gain access from the side to the disc for transforaminal endoscopic Duke laser disc repair, feel free to, as I said, ask questions as I navigate my needle down to the spine and into the disc space. Henry?
At this moment, no current questions.
This will be a great time for people to learn a little bit more about back pain and what causes it.
Of course.
All right, George. I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine touches the vertebral bodies with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. Welcome back. And we are trying to gain access into the L4-5 disc, which this will be the hardest. Shot. All right. I think we're off on orbit pretty bad. I think it's worse. Go the other way. Shot. A little more, huh? I think that's worse. All right, you may be right. Keep going. Shot. So the problem is a little bit more. This patient has pretty bad scoliosis, which is affecting our ability to visualize the spine. Yeah, it seems to be getting worse right now, Jordan. I don't know. You see the two you see the two transverse processes? Do you see them? What is that noise? So one is, bring your arrow up a little bit to the left, there, in that area, and there's another circle in the other, just further back. We need to try to line those guys up. Do you think you're good on WAG? I mean, looking at the L5 pedicle, it looks good. I just think the L4 is the issue. See, that looks like the TP I'm hitting right there, right in front of the needle. Right? You see it? That right there, that circle? Yep. The oval. All right. So, how do we improve our visualization of 4-5? We're pretty close to being as good as we're going to get, but I'm wondering if we can't squeeze out just a little bit. That might be a little better on 5, but 4 is a little worse on orbit. All right, folks, bear with us. We are trying to get into the first disc, number 4-5. This will be the most difficult shot. Man, I feel like I'm a mile away. AP. We're going to spend the beginning of the surgery getting into the disc. That's the hardest part. Yeah, too medial. Look at that. Interesting. Curve is towards us. All right. Need to go deeper. Shot. I think I'm going to start a little bit lower than I am. This whole area is numbed up. Normally, shot? No? Any questions? Feel free to ask them. In the meantime, while we're trying to get into the holes, the neuroforamen, at these levels, why don't we show our audience how a disc injury causes so much pain? Shot?
Copy that.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see from our video how discs cause horrible pain through inflammation. In the meantime, we're struggling to get around this facet joint. We are going to make it, but I want you to see how abnormal this left facet joint is at L4-5. You can see it on the AP. Show them. Look at the size of this facet joint. It is massive, massively enlarged. It's about 5 times bigger than a normal facet. That's because the spine is loaded on this side. It's twisted to the side, so it's more pressure on the facet. Facet in hypertrophies due to stress. Think about it. If you lift weights all the time with your right arm, never your left arm, the right arm is going to get big, the left arm stays small. You look like Henry.
Hey.
All right, just kidding.
No, you're good.
All right, we are right here, and boy, it is a bit bony here. I'm right at the back of that disc. I may have to wait until he is more asleep. So we're going to move on to the next disc, which will be a bit easier to do. I told you this is going to be the hardest one. We're making our incision, and now I'm going to access 3-4. Shot. You can see how much more space there is to get to 3-4. Shot. I got it. Shot. All right. If you have questions, feel free to ask. I'll do my best to answer them for you.
At this moment, no current questions. So in the meantime, why don't we show the audience of how it is we cure a herniated disc?
Shot? Yep. I think it's a great idea, Henry.
Copy that.
Thanks. Shot.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Okay, now that was a lot easier, wasn't it, to get those other discs? But the 4-5 was horrible, and I'm going to try one more time at 4-5. Yeah, Jordan, let's try 4-5. You can stay where you are, Jordan. I think you might be able to wag us in just a little bit. Shot? Well, we got time. All right, that looks pretty good there, Jordan. Shot? Yeah. Shot. Man. Oh man. You see what I'm dealing with, folks? That needle. Show us the needle, Jordan, so people can understand. The tip right there, yeah. I'm trying to get it into that 4-5 disc. And we're calling the disc below 5-1, but it's really more of a pseudo disc than anything. A fake disc. But it would never cause pain because it's a fake disc. So he's just so collapsed and full of arthritis at this level. I think I can get it when he's more deeply asleep. Hey, shot. Let's go AP. Just one more time to triple check. Any questions?
At this moment, no current questions.
Okay, great. Thanks for joining us. We're broadcasting live spine surgery from Duke Spine Institute. Looks good on the lateral view. I'm right at the back of the disc at 4-5. The other discs I'm actually in at 3-4 and 2-3. How long till he's ready for us to do our discogram? Need a little stimulation, huh? Well, I can try. We're right there. You can see it. Huh? Maybe we go in and do this disc while we're waiting. Guide wire. We've already shown you the 30 causes of chronic back pain video.
Correct.
As well as how a disc causes injury or pain. A disc injury causes pain.
Correct.
And how we fix it with a laser. So, at this point, we're going to advance the dilator down. You have any num-num? Huh? I understand. Oh, he'll wake up. Don't worry. Oh, we still want to be as humane as possible in the eyes of Dr. Berndes. Shot. The shot. Shot. You can see the tip of the dilator is right at the fascia. Fascia is a very pain-sensitive structure, but does not compare to the pain that comes from a disc pressure on a disc.
Hold on, my friend. You're okay.
Doing all right?
You're doing all right. Just talking now. Anybody want to I'm going to ask you some questions right now.
Can you hear me okay?
Dr. Duke? He said yes.
Lay still. We're going to put you back to sleep in a moment. How long have you had your back pain?
How long, sir? How many years? 20?
Mm-hmm. Good. You got that one right. Are you comfortable right now?
How are you feeling right now? You having any pain? No.
All right. You guys ready? Are you having any pain? Any pain?
No.
All right.
Yes.
He said no. All right. We're going to put you back to sleep in just a moment. So, folks, he's had 20 years of back pain. Comes from New Hampshire to Duke Spine to get rid of the back pain. You comfy? How bad is that on a scale of 1 to 10? How high?
10.
10. All right, my friend. I'm sorry about that. I had to test. Is that where you get your pain?
Is that where you normally
Shot.
get your pain? Yes.
All right, good. Lay still. We're almost done. Just don't move. And we're going to put you to sleep in about 10 seconds. How bad is that on a scale of 1 to 10? 10. Is that where you get your pain? Don't move. All right. Concordant. I'm not going to be able to test 4-5, but you get to go to sleep. Count out loud. When you wake up, the pain will be gone. So, folks, if you've been watching, we just tested the 2 discs that we could test, which is number 2, 3, and 3, 4. On the MRI, they're degenerated. There's tears in the annulus. I knew they were the cause of his pain based on his distribution of pain. He had pain coming deep in his spine right over 2, 3, 3, 4 and 4, 5. So I just tested those 2 discs, and indeed they were causing 10 out of 10 pain. It's concordant, which is the kind of pain he gets normally every day of his life. That's the pain he wants to get rid of. It's called concordant. So we got concordant pain on discogram shot. I could not test 4-5 because I couldn't get the needle in. And maybe, what do you think, Berndes? Should I try? Shot? No. You keep him safe. I'm fine with where he is here, if you're okay with it. Yeah, I don't want to go too deep. We'll see how he does. In worst case scenario, I can come back to this disc later. Yabba dabba doo. Huh? Huh? It's right there. All right, who says yabba dabba doo?
Fred Flintstone.
Yeah. Who is that, Henry
Yeah, that was me.
or Sanjay?
No, it was me, Henry.
Would Sanjay know?
I would not know. I know it's Fred Flintstone.
Yeah, it is Fred Flintstone. You're right.
Definitely not Sanjay.
All right, we are right there. So, let's see if we can get into that disc. It is a crusty, stuck down disc. And I really want to get this done. Oh boy, that's bad. Look at that. Ooh, that's bad. Shot. That is nasty. Nope. It is cemented down.
You want some kid out there?
Yeah. I'm going to try one more time, but let's do this. Let me pull it back. You have the grabber? Sometimes we have to hammer to get into the disc because it's so stuck down. Shot. Sometimes we don't get into the disc. No, hold the needles. I don't want to bring the needles out.
Maybe, please.
Damn. Shot. All right. We got it out. Let's move on to what, 3-4? So 4-5 we could not get into. We may try one more time, we'll see. But that disc is solidly stuck down. The bone is literally scarred from one bone to the other. It is not moving. And that facet joint is so hypertrophied, it's not allowing any movement either. So I think that his pain is coming from these two discs primarily because we don't have much movement. By the way, you have to have movement of a joint to have pain. This is a very important point. Must have joint movement to have joint pain. Joints that don't move don't have pain. And this joint, I think, may not be moving at all. Because we could not get it to lift and get that dilator in. But I'm going to see, maybe we'll try one more time. We'll see. We definitely had a positive pain coming from these other two discs, 2, 3, 3, 4. 10 out of 10. We're going to fix these. You could see him lift his body up when I injected the dye. Now you're going to see as I advance the dilator, it literally like shoehorns itself in. It literally spreads the bones apart. It's going right through the tear. You see that?
Yes,
So
we do.
people ask me all the time, aren't you doing? The answer is no, because we're going through the damaged part of the disc already. We don't create more damage that's already there. There's already tremendous amount of damage that's there, and we're just going past through the tear that's already there. We're not creating any new damage. And as we remove our tube, we're going to be cleaning the damaged part of the disc. All right, any questions for me?
No current questions, but we do have a comment coming from Hassan on YouTube
Hello, Hassan, welcome.
saying hello and thank you for being you.
Oh, thank you. Thank you so much. Is it a Hassan or Hassan?
Hassan with an H.
Hassan. Thank you, Hassan. Very nice to meet you. Where are you from, Hassan?
Once he replies back, I will give you that answer.
Hassan isn't that an Arabic name?
I feel like that it is, yeah.
Yeah. I want to put money on Egypt.
Egypt, I will say India.
You're going to say Egypt?
No, India.
Oh, where? Where?
India.
No way. A name like Hassan? I guess it could be. All right.
Give or take. I could be
All
I could
right.
be 100% wrong.
You're not cheating, are you?
I am not, I promise.
Who else wants to bet? We have one India and we have one Egypt. All right, we're going to get started here. We are looking at the bottom of the tube. The tube, remember, we put it into the tear of the disc. So what we're seeing here, it's not working. Did you forget to connect it? Yeah. All right. Gonna have to put horse blinders on you. Tell me when it's ready. I don't know if it's ready. All right. So laser fiber is right there. You guys can see it at 12 o'clock.
Yes, we do.
And the laser fiber delivers energy to the end of the fiber and releases it right out the end. So the type of energy being released is electromagnetic radiation. Remember, electromagnetic radiation is energy that travels in a form of a wave, travels through space, time, and there are different types of electromagnetic radiation or energy. Use the radiation and energy interchangeably. There's everything from radio waves, which are low energy waves, travel through space quickly, to very high energy waves like ultraviolet, infrared, laser energy. And what changes between these different energy types or electromagnetic radiation types is the frequency, the wavelength, and the frequency. The wavelength and frequency. The higher the frequency, the more energy. And frequency and wavelength are inversely related. So the higher the frequency of electromagnetic radiation, the longer the wavelength. So you have an inverse relationship between those two. And the greater the energy, the higher the frequency. The higher the frequency, the greater the energy. So obviously laser has a very high energy waveform, which is high frequency, short wavelength, and light, visible light that you guys see with your eyes like you're watching this surgery is another form of electromagnetic radiation.
We have a comment and a question,
Sure.
both coming from Hassan. The comment being, I am from Libya and a big fan of you. I am a sports physician interested in the latest innovations in this field so I can advise my patients.
Thank you so much, Hassan. Doctor. It's a doctor.
Doctor? Yeah. Sports
Dr.
physician.
Hassan. Yep. All right, doctor.
And their question being, thank you for your informative stream. I want to ask about the radiofrequency ablation for cases of disc bulge with sciatica. Is it true or a myth? And if it's true, when is it needed?
So, my friend from Libya, radiofrequency ablation does not work for sciatic pain, true sciatic pain. Sciatic pain comes from irritation of either the nerve roots within the spine or as they leave the spine in the neuroforamen, irritation of the nerve roots that make up the sciatic nerve, or irritation of the sciatic nerve itself. Remember, the sciatic nerve leaves the pelvic region and exits the sciatic notch and goes then through the piriformis muscle. So the piriformis muscle injury to the piriformis muscle, a tear specifically of the muscle. So the type of injury that happens to the piriformis muscle is a tear. And when the piriformis muscle gets torn, it can irritate the sciatic nerve passing through the piriformis muscle. Piriformis mediated sciatica is the second most common cause of sciatic pain. Sciatic pain, remember, is pain that goes from the lower back down to the foot. Okay? Now, facet joints, which is what you're talking about treating with radiofrequency, facet joints can cause pain that refers down into the leg, but it never goes past the knee. Never goes past the knee. So true sciatic pain goes past the knee. It goes down to the calf, ankle, foot, but definitely to the calf, past the knee. So facet joint mediated pain, which is why you do a radiofrequency ablation or rhizotomy, is only pain on the side of the spine, could be both sides, left and right, that radiates into the buttocks and thigh, but never past the knee, never past the knee. So whoa. Come on, stop screwing around, guys. Press
the Y balance over there, please.
Facet mediated pain is back pain that can radiate into the thigh. All right, here, grab her. But that's why you do a radiofrequency ablation. You don't do it for true sciatica or sciatic pain. I would never recommend that. Sciatic pain is almost always due to a herniated disc with stenosis. And the surgery you want to do is what I'm doing now, disc surgery, Duke laser disc repair. Facet pain is completely different. All right, we are now at the back or exit of the tear. We call it the superficial part of the disc tear. You can see the blue dye that I injected. You can see the torn fibers of the annulus. They're white right here. You can see the gold color is calcium. It should not be there. It's called dystrophic calcification. Your body calcifies abnormal tissues when there's chronic inflammation. So you must have you must have abnormal tissue. You must have associated chronic inflammation, and then you can get calcification. Great question so far.
We have another question
Sure.
coming from Raj on YouTube,
Yes, Raj.
asking, "Hi doctor, how
Hi.
does disc pain cause neck pain? I thought neck pain only comes from the facet joints at the back of your neck. Thank you."
Yes, Raj. Great question, Raj. Thank you. So the question for everybody is, how is it that a disc can cause neck pain? I thought neck pain only comes from the facet joints. Nope. The 90% of chronic neck pain comes from disc injury. That's why when you treat the facet joints, it does not take the pain away. The patient still has pain. The reason is because you're not treating the right place. The disc is accountable for 90% of chronic neck pain, 90%. You must do a surgery on the disc to get rid of the neck pain. Henry, why don't you run our video showing
Yes.
the 30 causes of neck pain?
Of course.
You got it?
Not a problem.
I'm Dr. Duke Machen, CEO and founder of the Duke Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3. Next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Duke plasma rhizotomy is the best treatment in the world available for painful facet joints. Duke laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain.
So from this video, you can see that there are 30 most common causes of neck pain. And majority of them is the disc. 90% of neck pain comes from a disc injury. The most common disc to cause neck pain is C5-6, then 6-7, then 4-5, in that order. 5-6, 6-7, 4-5. We are almost done with the L3-4 disc here, and you can see we're at 12 o'clock. There's a little foraminal ligament, some epidural fat. We are just cleaning the last of the tear. Now, Henry,
Yes,
let's
sir.
show our audience, how does a disc injury cause neck pain? It's the same way that they cause back pain that we're treating right now, but let's show how does a disc injury cause neck pain.
Copy that?
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
It's time for the real destroyer of pain. Right, Luis? The bringer and destroyer of pain. All right, you can see from our video that a disc injury causes neck pain the same way as it causes back pain. The tear in the back of the disc has inflammation, and that's what I'm cleaning right now, the herniation and the inflammation. By removing the herniation and inflammation, you eliminate the source of inflammation and pain. I'm taking away the herniation stuck inside the tear. That herniation that's stuck in the tear is the cause of back pain and neck pain in 90% of patients, 90% of the time. The facet joint is a very common cause of neck and back pain as well. As a matter of fact, in our research, we found that 45% of our patients with chronic back pain also, besides the disc pain, also had facet pain. That's almost half. It's a big number. So for most of our patients that we're treating the disc problem in their back, we're also treating the facet joints. Henry, let's show the audience how the Duke laser disc repair cures neck pain from a herniated disc.
Copy that.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4 mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
And welcome back. So you can see from our video that the disc pain in the neck comes from a tear in the back of the disc, in the wall of the disc, called the annular tear. And the nuclear material that's fragmented gets into the tear, and the body's response to that is inflammation. Your body is trying to heal the tear and get rid of the herniation. Problem is it cannot get rid of the herniation. But it keeps trying. It doesn't know that it can't get rid of it. So it keeps attacking and attacking for days, weeks, months, years. And every time your body starts attacking the herniation, again, you feel pain. Very painful. Any kind of pressure on the disc will elicit more pain. So bending, lifting, twisting, walking, standing, everything causes pain. Every kind of movement, because it's putting pressure on that painful part of the disc. And the Duke laser disc repair is the only surgery in the world where the source of pain, the annular tear, the herniation, the inflammation, is removed with a laser. It will become the treatment in the world that every doctor recommends for their patient. Unfortunately, most doctors don't know about it, so they can't recommend it. And it's going to stay that way for a long time until more people are talking about it. The problem is the companies that make the metal that goes in to treat pain, they don't want this surgery becoming popular because they're not making any money on our surgeries, because we're not putting metal inside the body. We're not putting any plastic. We're not putting any metal. We're putting nothing. It's natural. We're naturally repairing the disc. And they don't like that because their business model is to have surgeons and pain management doctors use their products to put inside patients to treat those patients' pain. But those products are unnecessary and they don't help. So we don't use them. They don't like the surgery because of that. It's a natural repair. There's almost no bleeding. You can see the incision is 7 millimeters. It's Band-Aid. There's no hospitalization. So the hospitals don't like this. The companies that make all the metal cages and screws and plates and rods and stimulators and all the disposables used for mild procedure and barricade and bone graft and stem cells, none of that is used. It's natural. They don't like the surgery. Surgeons don't like it because, number one, they don't know how to do it, and number two, you don't get paid very much as a surgeon to do the surgery. So you get much more money doing other things that don't work. So that's the problem. There's a financial incentive to not do the surgery. All right, any other questions?
Yes, we have a question from Raj, once more on YouTube,
Raj.
asking, is myelopathy a medical emergency? What's the appropriate treatment for that? What are the symptoms of myelopathy? Thank you.
Thank you. Is this the same Raj that joins us all the time?
Yes, correct.
I'm going to call him Raj Mahal.
Raj Mahal. I love
Raj
that.
Mahal. All right, Raj. Myelopathy was the question. What is this myelopathy business? Everybody knows what a spinal cord is, right? The spinal cord is the tissue that's shaped like a sausage or a tube that runs from the bottom of your brain down to your through your spine, and it gives off the nerves that travel. Why do we have no irrigation here? It gives off the nerves that travel from your spinal cord to your muscles in your legs and your perineal region, controlling your sphincters like your bladder and your bowel sphincters. It goes to your muscle joints, muscle tendons, and all these nerves are like electric wires bringing information from your body back to the spinal cord. And then the spinal cord transmits the information up to your brain. Okay? So myelopathy means dysfunction. So the spinal cord is not working properly. Dysfunction of the spinal cord. And myelopathy has many causes, right? It could be a tumor inside the spinal cord causing dysfunction. It could be a herniated disc pressing on the spinal cord causing dysfunction. It could be a fractured bone from a car accident or a fall pressing on the spinal cord causing dysfunction. The point is, myelopathy means dysfunction of the spinal cord, period. And it results in spasticity of your muscles where you can't control them, your muscles spasm, loss of control of your sphincters for your bladder, so you pee on yourself, you got to get to the bathroom quickly, you're going to have an accident, and bowel accidents where you poop on yourself, you can't control your sphincter, you start pooping in your pants. So you have loss of motor control in your arms and legs and your trunk, your posture. You have loss of sensation or feeling in your skin and your joints and your muscles and tendons. You have loss of control of your bowel and bladder. That's what myelopathy is. Loss of feeling, loss of motor control, and loss of bowel and bladder control. Okay, three things primarily. So it comes from dysfunction of your spinal cord. Now you asked, is this an emergency? Well, there are many causes of dysfunction of the spinal cord, right? We've already talked about a few of them. Something putting pressure on the spinal cord can cause dysfunction, but so can an inflammatory disease, right? For example, some people have a condition called multiple sclerosis, where they get an transverse myelitis, which is inflammation of the spinal cord due to this abnormal antibody, autoimmune disease, and that inflammation of your spinal cord will cause myelopathy. But that's not a surgical emergency. It's not. It's a medical emergency. You have to do some type of treatment with steroids and maybe plasmapheresis. Okay, but I'm not a neurologist. I don't treat my multiple sclerosis. I'm a neurosurgeon. We don't treat it surgically. So when you ask if myelopathy, 5 minutes, you ask me if myelopathy is an emergency. Yes, usually it is, but not always, because chronic myelopathy is not. It just really depends on how long you've had the myelopathy and what's causing it. That will determine whether it's an emergency and whether it should be treated. I hope that makes sense. No, we're done. Yeah, we can't get into the 5-1. Or 4-5, I mean. It's just solidly stuck down. which is actually good and bad. Good in that I don't think it's causing any symptoms for him. Henry, any more questions or comments?
At this moment, no current questions or comments.
All right. So far we've done lots. We've talked about a lot of things. But by the way, this is all scar tissue here. You guys see this white stuff?
Yes, we do.
That's the end plate, but this stuff here is scar tissue. You see it? That's from chronic inflammation. By the way, that pink right there is exactly where his pain is coming from. You can see it nicely there. That is the inflammatory tissue. That's what we're here to remove. Sometimes it's really pink like that. You can see it quite nicely. Other times it is harder to see. But look now. You see all this scar tissue? This comes from the chronic inflammation. Your body is attacking, his body was attacking the herniation for many years, probably 40 years. Actually, he's had back pain for 20, right? 25? 20. But he's had this herniation longer than that. And your body can actually attack the herniation longer than you've had back pain. In other words, the herniation may have happened 40 years ago, and he was attacking it with inflammation, but it wasn't painful because lots of people have herniated disc without pain. Okay, we don't know why, but basically the pain fibers are not activated. And he probably had this herniation longer than 20 years. If I had to guess, I would say 40 years. 40 years, based on what I'm seeing. We're almost done.
We have another question
Yes.
coming from Raj once more on YouTube,
Raj Mahal.
asking, Doctor, have you had spine surgery before? If you had, to who would you do your surgery for? Or for you?
Raj Mahal. I have not had spine surgery, but I've had back pain. I have a bad disc in my spine, but I have no pain now. The pain for me, thank God, only lasted for 2 days, and it went away. But it may come back, and I may have to have spine surgery. Right now, the only person I would trust to do my spine surgery is Luis. But Luis is unfortunately not a surgeon. He's my assistant. And maybe besides him, Dr. Patel. So my partner, Dr. Patel, and Luis, that's who would do my surgery. I would do your anesthesia. And of course, Dr. Berndes would do my anesthesia. I wouldn't trust anybody else. That's it. All right, just one more minute, we're done. Our next patient comes to us from Texas, the great state of Texas. As a matter of fact, he comes from Amarillo, Texas. Right, Luis? Amarillo. And you know why I like Texas so much? I like it for its people. But then after the people, there is something I like a lot about Texas. Anybody know what it is? The food. Thank you, Sam. Tex-Mex, baby. I love Tex-Mex.
That's one of my favorite food for
right?
sure. Yeah, I love Tex-Mex.
Don't feel bad though, Raj Mahal, because Indian food is also one of my absolute favorite. I love everything about Indian food. I love the fact that Indian food has such bold flavors. You know, Indians are not afraid to make tasty food. I love curry, dosa. I love all the breads, the naans, right? Yeah. I love naan, especially the chili cheese naan.
Oh, don't get me hungry.
Right? I love keema naan. I know, I eat lamb, it's horrible. I'm not a vegetarian.
My parents and I, we love lamb. It's the best.
Yeah?
Yeah.
And I even love biryani. Biryani is so good. Biryani is rice mixed with either chicken and vegetables, or you can do shrimp or lamb or goat, whatever you want. Biryani. Jordan, you like biryani? Never had it, but it sounds good, right?
When Dr. Patel did the food, no?
Huh?
When Dr. Patel brings food,
Yeah, but you got to go have better Indian food than Brevard County. Go to Orlando. Go to Orlando. Saffron. Great. Yeah, it's on Sand Lake Road. That's my favorite. Saffron. Sand Lake Road. Yeah, Saffron. Very good food. Very, very, very good food. Fast service. Anyway, any more questions?
At this moment, no current questions.
By the way, look at this, folks, right here. See this? I'm just picking at it. It's a piece of herniated disc. You see that?
Yes, we do.
It came out earlier. It's just one of many. It's about 5 millimeters. I don't know if you can see 5 millimeters there.
Yes, we can. Yeah.
You know, people ask me, is it one herniation? No, it's about 30 pieces per disc. And they come out little pieces at a time. You know, I put pressure on the muscle. Why? Because if you get blood in the muscle, a little bit of bleeding in there, it's going to cause pain in the muscle for like months after the surgery as the blood breaks down. And so I always put some pressure to minimize the amount of blood, but that's what hurts after the surgery, if anything. People have some soreness in the muscle from the blood. Yeah, it forms hemosiderin, which then causes muscular inflammation and spasms. All right, if there's no other questions, we'll end the broadcast. I thought it was a good surgery, and everything went well for him. Any questions?
No current questions.
Have a wonderful afternoon. We'll be back for one more surgery shortly.